welcome everyone. Thank you so much for joining this evening's webinar about menopause, your gut and vaginal microbiome, brought to you by Restless Events and My Menopause Centre. I'm Helen Normoyle. I'm the co-founder of My Menopause Centre, and I'm joined this evening by two brilliant doctors and experts in their respective areas. Dr. Anna Greaves is a registered menopause specialist and an NHS GP. She graduated from the University of Birmingham in 2008 and is a diplomat of the Faculty of Sexual and Reproductive Health and the Royal College of Obstetricians and Gynaecologists. Anna's been a GP for over 10 years. She's always had an interest in women's health. And while working as a GP, she saw that there was an unmet need to support women struggling with the perimenopause and menopause, and seeing the vast range of physical and mental impacts and hearing stories of these women inspired her to undertake the advanced menopause training with the British Menopause Society. We're very fortunate to have Anna work with us at My Menopause Centre, and Anna also works in an NHS menopause clinic, and she has a particular interest in gut health and how it impacts our physical and mental well-being. And later on, I'll post a link to a brilliant article that Anna wrote for us. Now, Dr. Jo Bailey is a consultant gynaecologist and looks after women with general gynecological problems. She is also a subspecialist in gynecological cancers and precancers. Dr. Jo graduated from Glasgow University Medical School in 1993 and completed training in general obstetrics and gynecology in Newcastle. After that, she moved to the Southwest for advanced training in the treatment of gynecological cancer and never left, being appointed as a consultant in 2006. As part of treating women with cancer, she is particularly interested in ensuring that women live well with minimal side effects from their cancer diagnosis and treatment. And this led her to being part of an NHS menopause clinic, advising women with complex menopause concerns, including a specialist oncology menopause clinic. And we're so grateful for all the work that you do in that front, Jo. It is much, much needed. And as a gynecologist, Dr. Jo often sees women with difficult to control vaginal symptoms and has been fascinated by the impact of the microbiome on vaginal health and the opportunities offered by probiotics for treatment. And as we all know, vaginal health is really one of the big taboos in menopause, and that's why it's so important that we're normalizing the conversation by having this evening's webinar. And as you know then, up until recently, the gut microbiome has gone from being something that no one had really heard of until a few years ago to being a topic everyone is talking about. But as I said, we hear less about our vaginal microbiome. Now, our philosophy at My Menopause Centre is that knowledge really is empowering. And that's why in this evening's webinar, we're going to do a gut and vaginal microbiome 101, where we look at what a microbiome is, how our gut and vaginal microbiomes impact our physical and mental well-being, why it's important to look at each differently. And we'll also hear how the menopause transition impacts our gut and our vaginal microbiomes, as well as take a look at telltale symptoms and the best ways to look after these. Now, before we start, those of you who have been on these webinars before will know the score. Please do feel free to put your questions into the chat and we'll do our utmost to get to each one. And as I'm sure you can appreciate, the doctors won't be able to answer individual specific medical queries, but they can, of course, respond on a broad or general level. So without further ado then, we're going to start our gut and vaginal microbiome 101 with a question for Dr. Anna. Dr. Anna, if you could just start with the basics, what is a microbiome?
Absolutely, good place to start. So there are two terms that really we use. Microbiome specifically actually relates to the genetic material of all the microbes in any given environment, and microbiota actually refers to the microbes themselves. However, we tend to really use these terms pretty interchangeably. So when we talk about a microbiome, we're normally referring to the microbes. And obviously in this case this evening, I'm talking about the human gut, and Jo later on about the human vagina. So in the human gut, there are trillions of different bugs. These microbes, the majority are bacteria, but there's also viruses and fungi and lots of different things. Really, this collection that's in our gut is individual and unique for everybody. So it's affected by our genetics, by our diet, by our age. So everyone has a unique profile there. But also these bugs aren't just passengers. So we know that actually the DNA that they carry and the genes that they code for lots of really pivotal functions within our body. So they are really important in how we function. They're not just something that just exists within us.
So that's really interesting. And as I said at the top of the call, we've gone from not really, certainly from what I can see, talking about microbiomes or the gut microbiome to it's really burst through into public consciousness and into the media. So has the medical profession, always been aware of this, or is this a very recent topic, or is it just we got a better understanding of the role of the microbiome recently, Anna?
Yeah, so the significance of the microbiome really has only recently become apparent. We've been aware for a very long time that there are bacteria within our gut, but I really think that we did think of them more as being passengers and just something that existed there. There's been a few things that have really allowed us to understand that more and know its importance as well. So one thing is advances in technology. So we now have quite a few really good techniques like sequencing techniques and metagenomics that have allowed us to really map out microbiomes in a way that we really couldn't do before. So that's been really important. On top of that, and maybe partly because of it, we've really realized what the gut is, and it's been maybe really quite underestimated before. We've thought of it as being quite a simple digestive organ. And actually, I think we now know how it's really dynamic. It's very interconnected with the rest of our bodies. And actually, what that also, the sort of extrapolating from that, what we've realized is that when there's an imbalance in that gut microbiome, it's actually very closely linked with an increase in certain diseases. And really important and very common diseases increase in obesity, increases in type 2 diabetes, and even some cancers. So we really have understood the importance of it, but also we're able to map it out in a way that we really couldn't do before.
Amazing, just the advances in medical understanding and technology and how they're helping us. And then before I move to Dr. Joe, and we'll delve into this in more detail in a few minutes, but does our gut microbiome also impact our mental well-being, or is it mainly just the physical symptoms that manifest?
No, it absolutely has an impact on mental health. And I think when I first read about this, it really surprised me. And then I suppose I thought about everyone's probably had a time when they've had something that's worrying them that's coming up, something they're feeling anxious about, and experiencing that feeling of butterflies or even having to rush to the toilet. And when you think about it, our body does give us quite a lot of signs all the time that there is a link between our gut and our brain, but we maybe don't necessarily give it as much credit as it's due. And we do have this gut-brain axis, which is very powerful. And that means that our gut microbiome through this axis does have an impact on our mental health. There are quite a few ways in which it does this. Just to list some of them, for example, the microbiome is involved in the production of dopamine, serotonin, GABA, all these very important neurotransmitters linked with our well-being. On top of that, there's a nerve called the vagus nerve that actually directly links our brain with our gut. And through signals and pathways, there's an impact the microbiome can have on that nerve. And then also we know that when there's an imbalance in the gut microbiome, you can get more, the integrity of the gut wall can be compromised, and you can get bacteria that go through there. It causes some inflammation. And that long-term chronic inflammation can then pass to the brain and can affect the function and can exacerbate anxiety and depression. So we absolutely know that there's a lot of impacts it can have. And in fact, something which I find fascinating is the way that researchers have really explored this more. And that's largely through a technique called the fecal microbiota transplant. So they've taken literally samples of poo from one person, they've put them into another, and they've seen what happens. And
Wow.
the studies have, multiple studies have replicated the same results, which is that if we take a sample of poo from someone without a mental health disorder and we put them into somebody with a mental health disorder, like depression, anxiety, actually done with other diseases too, but in this context for mental health, there is a significant improvement in their symptoms. Not forever, often for sort of a few months, maybe a little longer, but it's fascinating work. And we also have realized that we put sort of more connections together. So there are specific bacteria and bugs that are linked with increased instances of depression or anxiety. So there are specific strains of microbe linked with mental health disorders too. So lots of different things going on there.
Anna, that is absolutely fascinating. And I have to say, I'm very glad you translated into plain English. I can't even remember the medical term that you used, but I definitely got what you were saying about the poo transfer.
Yeah.
But it's really fascinating just, how holistically our bodies work and the way everything is interrelated and interdependent. And we'll definitely come back to physical and mental well-being and how we look after that in a moment. But Dr. Joe, then on that basis, so Anna's just given us an overview of our gut microbiome. tell us then, because I presume most of us will be starting from a place of zero knowledge about the vaginal microbiome and why we need to look at it differently.
Yeah, and I think that what we're discovering more and more is that we have microbiomes in all sorts of parts of our body. And what I think is fascinating is that they're not necessarily the same. So whereas with the gut microbiome, we know that diversity and things like that is good, in the vaginal microbiome, it's much more limited in the bugs that we naturally have in our vagina. And I think that the research in the gut microbiome is way more advanced than it is in the vaginal microbiome. And, you know, we can speculate why women's health isn't as well researched as things that affect men. But there's definitely, you know, a tendency to funding that affects men. And so we are learning more and more. But I think that we know with the vaginal microbiome that we've got lots of bugs in our vaginas, and some of those are good bugs that help the defenses in our vagina, and others are the bugs that can cause problems. So things like bacterial vaginosis, recurrent urinary tract infections, and also thrush. And a lot of those disorders are caused by an imbalance because a healthy vaginal microbiome has lots of lactobacilli, and those produce lactic acid, which lowers the pH of your vagina. So a healthy vagina actually is slightly acidic, and that keeps all those other bugs at bay, and also forms a defense of the bugs that can cause urinary tract infections. So I think that we are starting to learn more and more. There are even papers now about how a healthy microbiome can protect your bones and bone health, which for menopause is very important. But I think that compared to where we are with the gut microbiome, we've still got quite a long way to go. But at least we can harness, perhaps copy some of the technologies that have been used to explore the gut microbiome and transfer that knowledge too. And I think there's also a very interesting interaction between the vaginal microbiome and the gut microbiome. And, you know, I think human beings are quite fascinating, and actually, in some aspects, left alone, actually sort themselves out quite well. But then we have changes, and we've seen the vaginal microbiome can change across the reproductive lifespan. So there is more and more research looking at that. So I think we're kind of just at the start of all this compared to where we are with the gut microbiome. But I think what I notice in a lot of my patients now is that there's a move away from wanting antibiotics and in some cases, particularly our younger patients, hormones, and they're looking for things that will harness the potential and modify what is actually happening normally in their bodies to improve their general health. So I think that's where this is quite exciting.
And actually, that's absolutely fascinating. As I say, up until I spoke to you, Dr. Joe and Eleanor, the founder of Pelvic Relief, with whom you're working, you know, the thought of even a vaginal microbiome hadn't even entered my consciousness. But it's obviously very important, particularly as women go through menopause. So can you maybe help us to understand how going through the menopause transition impacts our vagina and vaginal microbiome in particular, and why it's maybe of particular relevance given some of the other symptoms of menopause that can impact women?
So we know that estrogen is really important for the integrity of the vaginal mucosa, which is the lining of the vagina. And the mucosa of the vagina produces the mucus, which helps with lubrication and stops the vagina getting dry. And also that provides the food sources for the good bacteria, the lactobacilli, that then produce the lactic acid. So as your estrogen levels fall as you go through the menopause, that affects the lining of the mucosa of the vagina and makes it thin and dry and inflamed. And we know that, 50 to 70% of women will have genitourinary symptoms of the menopause, because you have estrogen receptors not only in your vagina, but in the neck of the bladder and the water pipe. And that's why we've sort of now used the terminology genitourinary syndrome of menopause, because the same things affect the urinary tract. And that's why a lot of women in menopause get recurrent urinary tract infections. And so we know with the microbiome that if your mucosa is thin, it's not producing the glycogen that helps keep these bacteria functioning and lowering the pH. And that leads to the symptoms that many women experience, which is the dryness, the burning, the soreness, the pain during sex, recurrent urinary tract infections, having to go and pee more often, all of those symptoms that are actually quite distressing, and have been for a long time quite difficult to talk about. And again, I think if we go back to where we are with research and sort of knowledge about the vaginal microbiome, when I've been talking to journalists in the past, I've had them say, well, my editor won't let me publish this because I can't talk about vaginas in this publication. So there's a whole bunch of women out there who are not, getting access to that knowledge. So we also know that, the common treatments for vaginal dryness and soreness, like intravaginal estrogen, is very good at improving and thickening the vaginal mucosa and restoring that microbiome. And there are lots of studies now looking at the impact of lack of estrogen on the microbiome, and therefore what estrogen does to improve it. And we know in the menopause that there is a decrease in those lactobacilli, and that can exacerbate the symptoms.
Yeah, look, you called out some really important things there, and we've had several questions around vaginal symptoms in menopause. So I think this might be a good spot to take them. And I'll come to you, Joe. And Anna, if you've any other thoughts, or feedback on this, feel free to jump in, and then we'll come back to gut health. So I've just put a link into the chat about vaginal changes in menopause. It's a really helpful overview of what's happening and treatment options. But as you've called out, Dr. Joe, this can become a real issue for women as they go through the menopause and get progressively worse with age. We've got some great questions in here, which I'll put to you and Dr. Anna. So one is around how Vagifem or vaginal estrogens work in helping or not the vaginal microbiome and in managing bladder leakage, and what might cause it to be less effective.
So I think we know that estrogen is helpful because of those estrogen receptors. We know, and I think, I've been a gynaecologist now quite a long time, and everybody is different. And I think that sometimes you need that estrogen, and that can be helpful. And then sometimes women find that it's less effective. And when we prescribe things like Vagifem, the estrogen pessaries, we tell women to take it daily for 2 weeks and then twice weekly. So that 2 weeks is to kind of build things up. And sometimes what I do is that if it's become less effective, I say, well, just go back to using it for 2 weeks again, see how that is. Or sometimes we switch preparations. But we're now finding that women in the menopause who have more severe symptoms of GSM, their microbiome is different. And so maybe one of the approaches, and we're hoping to do some research on this, is to support that not only with estrogen, but with the very vagina-specific probiotics that contain the lactobacilli that are important. And I think that one of the things that often annoys me in the media is about menopause and one size fits all. And I think we just have to look at things a lot more individually, because every woman's different. They may have other medical problems. They may have had breast cancer, all sorts of things. So I think we need to individualize what's happening so that we can find the best solution for that individual woman.
And then just a couple of questions linked to that, and you can probably see some of the really good questions that are coming in. So, and this is if I focus in specifically on bladder issues, so leakiness, you know, urge to go to the loo. Do you feel that for women who are using vaginal estrogens and they've taken them so far, do you feel then, based on what you're seeing, Joe, and I appreciate there's more research to be done, that probiotics are a potential additional solution for women here?
I think it's certainly something to consider, because we know that the vaginal microbiome, I think, is like the kind of defense soldiers for your lower genitourinary tract. And so if you've got those on board, that can be helpful to prevent recurrent UTIs. Sometimes it's a little bit more complex than that, because it depends, obviously, what's happening with pelvic floor and with the muscle of the bladder itself. So there can be other things that, you know, are required in terms of pelvic floor exercises, bladder retraining, and other interventions to help the bladder. So I think it's sort of part of that wider picture and assessing what's going on for that individual woman. But I think these are some very simple things that you can do to see, well, is this going to work? Is that going to be the helpful thing? And looking after your skin, I think our skin gets much more delicate as we get older. And I deal with a lot of women with vulval problems, and, you know, avoiding using soaps, using emollients like E45, Cetraben, Diprobase to wash with and as a daily moisturizer are really important. And helping that sort of lubrication of the vagina with vaginal moisturizers. So I think we've got much more in our armamentarium now to try and help those things.
And then some great advice and recommendations there. So potentially a range of solutions that are needed to address the issues. And as you say, and I know we see this all the time, every woman's symptoms and solutions are going to be different. It isn't a one size fits all. But how would I know if there were issues with my microbiome and where a probiotic might help? Are there tests available to do that, or what's the process?
For vaginal symptoms.
Yeah.
So we have started off by, you know, fairly basic tests with measuring pH. So measuring the acidity of the vagina, and a healthy vagina will have a pH of about 3.5 to 4.5. So if the pH is higher than that, then that's a good indication that there is an imbalance of the microbiome. I think now, as we have with, as Anna was mentioning, that technology has moved on, and some of the tests we have now have much more specific analysis of, you know, what is going on in those different bugs in the vagina and what is dominating and what is not, because we know it's the lactobacilli that are important. So we now have, you know, a greater range of tests that we can harness and try and do things individually. So I think we're getting there. As I say, I think testing will become more important, as it has, you know, for, you know, moving on as it has for the gut microbiome, and also will enable us to do more research.
And are these tests done? Do I need to go see a healthcare practitioner, like here in the UK? Would I need to go to my NHS surgery, or are there over-the-counter tests that can be like reliable over-the-counter tests that can be purchased?
So, I mean, you've mentioned pelvic relief, and we do have pH testing, and coming soon, we will have sort of much more bespoke testing that will give us much more information about the microbes in the vagina. So those things are coming via pelvic relief, and I think it's very exciting. I think we will find out a lot more and further the research. I think the difficulty is that even amongst the medical profession and some of my gynecology colleagues, the knowledge of the vaginal microbiome is lacking. I know my sexual health colleagues that I work with are really interested in it. So it is about measuring pH, and those are actually easily available online. And that, I think that's a good starting point. I think if you go to a doctor, depending who you see, they may not have much knowledge about it, because part of doing some of these webinars and other things is to, expand that knowledge and pass it on.
Yeah, and I think Eleanor is on the webinar this evening. So Eleanor, if you are, it would be really helpful if you could add a link to so people can see what the products look like and where they can get them. And otherwise, I'll send it out in the chat afterwards. And then just a couple of other questions, and Anna, we'll come to you in a moment on the gut health, and we've had some questions on that as well. So we've covered the questions about OTC tests for vaginal microbiome. A really interesting question from a lady in Switzerland. She's saying that there's a vaginal probiotic available over the counter in pharmacies, but it's a capsule. So her question is, practically, will that really reach her vagina? Is it going to be helpful, or should this be inserted via the vagina, as is the case with vaginal estrogen?
So we've got some good data on using oral probiotics, and I think again it comes down to the interaction between your gut microbiome and vaginal microbiome. Oral preparations do work, and so I think that's entirely reasonable. And in fact, we've developed oral preparations with Ultimate V, and there was some really interesting research about how some trans patients who have neovaginas used oral probiotics to colonize their vagina with their neovagina with normal microbes. So we've got proof that actually does reach the vagina.
That's really helpful and really good to know for people that are considering it. And Eleanor's posted that link into the chat as well. And then maybe a word on, and Joe, particularly given your background in treating cancer patients, because sometimes people wonder if they're not allowed to take HRT, if they could take a vaginal estrogen if they've had cancer. And this is a comment from one of the women in the chat, and we'll come to that in a moment. But what's your advice or feedback for women on that front?
I think it depends. And so women who are on letrozole, drugs like that, aromatase inhibitors, there's no utility in using intravaginal estrogen, because those drugs block the enzyme that helps the conversion to estrogen, so it just won't be helpful. I hesitate to give any further advice, because I think it's a lot of, for breast cancer in particular, if you've had breast cancer, then it really depends on what your cancer is, estrogen receptors, and what treatment you've had, and what, if any, ongoing endocrine treatment you're having. I think it's therefore difficult to make a generalized statement. But if you haven't had breast cancer, but you've had a strong family history of breast cancer, then you can use intravaginal estrogen broadly. I don't want to make generalized statements. But because the amount of estrogen in those preparations is very small. So, for example, the amount that's in them, you'd have to use that for a year to get the equivalent of 1 tablet of oral HRT. And there's no evidence that intravaginal estrogen increases your risk of breast cancer compared to
so the key thing is to speak to your oncologist or menopause specialist to have the conversation about what's right for you, because as we've discussed, every woman's situation is different. But it's important to know the range of options out there for you to speak to your doctor about, to understand what's right for you. So, and Eleanor, thank you for posting that information about when the screening test is launching at the end of this month. Thank you, and we'll come back to that at the end of the session as well. And then just one last quick question on vaginal estrogens, because I know we get this a lot too. Some women ask, can I take a vaginal estrogen, or do I need to take a vaginal estrogen if I have these symptoms, if I'm already taking HRT?
The answer is yes, you can. I think that sometimes, as we've discussed, those genitourinary symptoms can be very difficult to control. And I often say to women that sometimes you just kind of, if that's your main symptom and everything else has got better, you probably just need a sort of local boost of estrogen to help those very specific symptoms. And often, we recommend a lot of Yes Vaginal Moisturizer to our patients, both as a regular twice weekly moisturizer and also as a lube. So I think that sometimes you do just need that much more targeted treatment if your predominant symptoms are genitourinary.
Yeah, thank you. And yes, I know we don't normally endorse products, but I think we do recommend Yes products because they're very clean. And I know we'll come to in a moment when we talk about management of symptoms, specifically about the importance of understanding the ingredients in the products that you're using and how they can irritate. I know we're going to have some more questions that we'll come back to you on, Joe, in a moment. You can see them there in the chat. But if I come to Anna, to you. So we've had a really great conversation here about the vaginal microbiome and how it's impacted by menopause and solutions. Let's look at doing the same now around our gut microbiome. So starting off with, how is our gut microbiome impacted through the menopause transition?
Absolutely. So we know that if we take boy-girl twins and we look at their microbiome through their childhood, they're very similar. When they then go through puberty, a girl's microbiome changes dramatically and looks very different to a male twin sibling. So we do know that sex hormones have quite a big influence on our microbiome, and that's also true the other side of things. So when we go through the menopause, we know there is changes. There is a lot of research that we need to continue doing to really give us the full picture, but we certainly do know that as our estrogen declines, we do get a reduction in diversity in our gut microbiome. And as Joe said, maybe different in the vagina, but in the gut, we like diversity. So lots of different kinds of strains of bug. So that decreases. And we also know that the composition of the gut tends to change so that it becomes more similar to a male at a similar age. And that is actually a less healthy picture and linked with insulin resistance and weight gain. So there are some negatives there. We also know that when we reduce our estrogen and progesterone, we often get more leakiness of that gut. So the barrier function decreases and we get more inflammation. The question initially was, how does the menopause impact on our gut microbiome? But actually, we've also got the reverse question. How does our gut microbiome impact on our menopause? And what we do know is that our estrogen that comes into the gut is due to be excreted, but we know that we do have some bacterial strains that can break down that estrogen in a certain way, and then we can recycle it essentially and get it back into our system. So a healthy, really well-functioning gut microbiome can actually increase our levels of estrogen and offset our menopausal symptoms. So, nurturing our gut microbiome can actually make our menopausal journey better.
So the $60 million question, Anna, how can we nurture our gut microbiome to help with all those pesky menopause symptoms?
Yeah, absolutely. So as not probably a big surprise, the biggest component here probably is our diet. As you can imagine, what's going through our gut will have a big influence on what's in there. The first and most important thing probably is fiber. So we know that the bugs in our gut, they need fiber. That's all what they can eat, and the only source of fiber we have is from plants. So we want lots of different plants. Plants come in the format of fruits, vegetables, nuts and seeds, herbs and spices, and grains. So it's not just fruit and veg, but we want a real breadth. We want at least ideally 30 different plants in our diet every week, and that gives all of our bugs what they like the best. So they all like different things. Insoluble, soluble, there's lots of different things about fiber, but we just want lots of it and lots of different kinds, and that really nurtures them. Fiber's also good for stopping constipation. It reduces our risk of colorectal cancer. It reduces toxins. On average, we want an adult to have about 30 grams per day, but in the UK, the average is about 15 to 20. So we know that a lot of us do struggle to get the right amount of fiber per day. So it's really giving that some active thought, because sometimes just sort of presuming you're getting enough isn't necessarily true. And in that sense, I won't go into detail, but legumes are really a good source. So we can, from one serving of lentils or beans, we can get about half our daily requirement of fiber. So that's a really good place to start. We then want fermented foods. So this is a natural source of live cultures and natural probiotic. So these fermented foods come in lots of different formats, things like kombucha, which is a fermented tea, kefir, yogurt, sourdough bread, blue cheeses, kimchi and sauerkraut. So lots of different ways, but ideally getting at least a few portions of that in every day, and that will really boost our microbiome. We want lots of healthy fats. So fat's been quite demonized really over the last sort of few decades. And I think we really want to get across the idea that we need fats, and healthy fats are fantastic for us. So we want lots of fats such as extra virgin olive oil, oily fish, nuts and seeds, avocados. We do want to be careful about our sources of saturated fat like red meat and butter, but these lovely unsaturated fats, we really want to make sure that we're getting those in our diet. And then we really want to avoid processed foods. So I could speak for a long time about this, but to try and sort of summarize it and keep it, simple.
I think I might have just lost Anna. Can you hear Anna, Jo? And you were on mute. Yeah, got you back.
No, I can't, and her screen is frozen.
It's frozen. So we'll Jo, I'll come back to you while we're waiting. I'm sure Anna will be back in a moment. So just looking at the yeah, I'm sure Anna's going to dial back in, and we'll pick back up with her.
Sorry about that.
Yeah,
Oh,
Anna, you're back again. Right, I just need to find you and repin you. No worries, Anna. So I will look for you and pin you to the screen. Yeah, I've got you here. So Anna, we lost you just a moment ago. There we go. We have you back. So
Brilliant.
You were talking about you were in full flow about the things that we can do to keep our gut microbiome healthy.
Yes, so I think I was talking about fats. Did you hear about
Yes.
that? Yeah, okay. So we want healthy fats, but avoid our sources of unhealthy fats like saturated, like red meat and butter. Then the next step really is trying to avoid processed foods and ultra processed foods. So I think really we sort of sometimes think of that as being synonymous with fast food, but actually sadly it's much more ubiquitous than that. So around about 60% of supermarket foods are ultra processed. And really, if you look at the ingredients list, if there's things in there which aren't in your kitchen, things like emulsifiers, then it's something which is ultra processed, and that can have a really detrimental effect on our microbiome. Then a few things which are maybe a bit more holistic as well. So obviously plenty of fluids, making sure we're drinking ideally 2 litres of clear fluid per day. We want to think about stress management. So when we are stressed, we know that has a direct impact on how our gut functions. So we want to really focus on stress management. And I think women, especially around the perimenopause and early menopause, can be a phase in their lives where they have so much going on. They have lots of caring responsibilities, possibly with children and with older parents. They've got lots of career demands, and it can be a very difficult time of their lives in terms of a lot to juggle. And sometimes their mental health and their stress management can sort of fall to the bottom of the pile. So sometimes it's really just giving that the importance it deserves, and trying to think how you can actively put it on your daily or at least weekly to-do list, in terms of whether that's going for a nice long walk, meditation, mindfulness. There are lots of ways we can try and do that, but really meaning that you do it regularly and it's something that you've given some thought. And then exercise, again, I could speak for a long time about exercise, but we do know it has a really direct importance in keeping our gut microbiome healthy. So it doesn't have to be going and doing a HIIT class at the gym every day. Simple movement is really powerful. So just making sure that you're on your feet when you can be, you're moving around, and obviously if you can throw in some other exercise, fantastic. But keeping on your feet and busy is a really good place to start.
Excellent, Anna. That's really comprehensive, and I've posted a link to the brilliant article that you did for us into the chat as well, and people can read more detail. But a couple of things, if I may. Right. So you mentioned the benefit of having 30 different plants per week. Now I know that can feel a bit overwhelming to people, but when you actually break it down, it's not as overwhelming as it sounds. Can you explain that a bit to people around how that's actually very achievable?
Yeah, absolutely. So I think, as I said, so if I think about plants, initially I really thought about fruit and vegetables, and I think when you think 30 a week of different vegetables and fruit, that does feel a lot. But when you then factor in herbs and spices, which hopefully people would be using regularly in their daily cooking, but certainly you can be a bit creative. So if you have porridge, you can put a bit of cinnamon in there, and things that you wouldn't necessarily do but can make it more interesting, and actually little ways of just getting extra bits of plant into your diet. Nuts and seeds, again, something which you can just sprinkle onto almost anything you're making and eating. Mixed seeds, you can keep it easy by getting ready-made mixed bags. So you know that every time you put a handful on, you've got 5 different seeds or nuts in there. And then grains. So that's another way of making it another part of your meal. And also even things like the color of fruit or vegetables. So if you bought a packet of peppers and there was a green, a red, and a yellow, that's 3 different plants it counts as, because there's all these different polyphenols in there, and every different color represents different polyphenols. So actually, if you break it down and think about it, hopefully with a few tweaks or even realizing what a plant is, it may be more achievable than you think.
Yeah, that sounds a lot more achievable when you break it down that way. And probably if we all were to record all the different things we're adding into our meals, we could easily get there or see the way to getting there. Now, Anna, what are the telltale signs or symptoms of a gut microbiome that's out of balance?
Absolutely. So we talk about good and bad bugs, but really that's a little bit too black and white in reality, but there's obviously some truth in it. And when we have a lovely, peaceful, harmonious environment in our gut, we call it eubiosis. When we have an imbalance, we call it dysbiosis. So the dysbiosis can happen if we have an increase in those bad bugs, a decrease in the good bugs, or if we simply reduce the diversity. All those things cause a less healthy gut microbiome. And all those things result in some gut symptoms, as you might expect. So women can find a bit more bloating, a bit more excess gas, a change in their bowel habits. But you can get much more generalized symptoms too, really sort of going back to what we talked about earlier in terms of the impact on a lot of our body systems. So you can get more increased joint aches, you can get low mood, you can get brain fog. So there are lots of different things which can be difficult to piece together, but certainly it can have quite a big impact on it and give you a range of symptoms.
Yeah, and that's interesting because all those symptoms that you mentioned there, they're also symptoms of menopause. So as you said earlier on, they can exacerbate, they can compound each other then and interact with each other.
Yeah, I mean, I think there's bacteria that produce something called short chain fatty acids, and these are things that are really important for digesting fiber. So we can't do that on our own. And so if you go through the menopause and you have this slight imbalance and you're producing less of this, then you can then digest fiber less well. So obviously all these wonderful foods I just mentioned, all those plants and legumes, you can then find that you get much more bloating and gas after eating them, which can put people off. So it's something which women can say, I've tolerated this before, but suddenly I get really bloated, and they sort of question intolerances and different things. But actually that can really stem from your gut microbiome changing, and trying to tackle that can then obviously enable you to eat those healthier foods which actually nurture your biome.
And what are your thoughts then on the gut microbiome tests that are out there? Can they be beneficial or?
Yeah, so I think there are some really good tests out there to look at the composition, some stool analysis tests. I think it's a very personal decision, but I think talking through the pros and cons can sort of give people a bit more information to think about whether they'd want to explore that as an idea. So I think the positives about it are that obviously it does give you an insight into what's going in your gut. It gives you an idea of the profile you're looking at, and with some guidance, you can then get towards thinking, well, maybe do I have any evidence of dysbiosis here? I think it's fantastic for curiosity's sake, in terms of it's a good part of the journey to learning more about your microbiome, understanding it exists, understanding it's important, and then making the changes you want to make. And also there are some companies out there now which do have some quite robust evidence to look at your profile and then link it with some personalized nutrition, which can be really useful for some people. On the cons, I would say that at the moment it's quite early days. We don't have any standardized protocols. So in terms of how we interpret that, it's really not easy or black and white. On top of that, this is really a snapshot, and our gut's very dynamic. So we're looking at one day in one sample, but actually that can change quite quickly. Also, it can be quite costly. And then the final piece of that is that much as you might know how many or what different bugs you have in there, really in terms of applying that clinically, so looking at the functional impact of that, we don't really have good enough information at the moment. So I think it can be really interesting information, but I would say at the moment, in terms of clinical applications, really making it useful for you and what do you do with it, it's not really quite there yet.
Okay, so Yvonne, but that's really helpful to get that overview of the pros and the cons. And I've just seen a question come in. Thank you for asking that from a woman on the webinar this evening who missed the piece where you talked about how you can increase your ability to digest fiber. Would you mind recapping on that, Anna? So in order to reduce bloating as well as aid digestion.
Absolutely. So we know that when we have this dysbiosis, this imbalance in our gut microbiome, then there are these bacteria that produce short chain fatty acids, and that's what breaks down fiber. So there isn't a hard and fast way of nurturing those bacteria very specifically, but we do know that bloating and gas can be a sign of your gut microbiome being unhappy and being a bit imbalanced. So really looking at supporting your gut microbiome as best you can largely through diet, but also, as I said, through exercise and fluids and stress management is a really good way of starting. I appreciate that's a lot of things, but I suppose they are also incredibly healthy lifestyle changes anyway. So it's sort of things that are going to benefit you in lots of ways, but this is another one of them.
Excellent. And then just linked to that then, do you think that does HRT have a role to play through the menopause transition on impacting the health of our gut microbiome?
So we do have some good animal data to suggest that HRT can really help the gut microbiome. We don't have that extrapolated into humans. So we don't yet have good enough research to say, yes, taking HRT will definitely restore your gut microbiome to what it was 10 years ago. But we do have good evidence that's emerging, and it does make it sort of common sense wise, it makes sense. So I think that we obviously often find that women on HRT come back saying that there are a huge number of benefits they didn't necessarily foresee. So they come back and say, yes, my flushes have got better and my aches and pains have got better. But actually, as well, I didn't realize, but actually my brain fog's gone and my bloating's gone, and I find that I can eat foods I was starting to find more difficult. So anecdotally, we're getting some of that feedback, but I suppose the evidence at the moment isn't strong enough to say a definite yes.
Yeah, okay. Excellent. Thank you for that. Like so many things in women's health, we just need more data and more research. So if anybody's on who's got some funding for women's health, you've got some willing takers here. And a great question here, last one to you on this, Anna, and then we'll come back to Joe. But question here about is it helpful to take a probiotic as in a tablet every day as well to look after your gut microbiome?
So probiotics obviously is these live cultures of bacteria, but distilled into a tablet or a drink. The research is a bit patchy. There is mixed data. There is some benefit to it, but I think what overall we're realizing is that there is more benefit seems to be being gained from using diet rather than using probiotics in a distilled format. So as we've talked about, diversity is really important, and some probiotics are one strain of bacteria. And either way, a lot of the choice of bacteria really comes down to what can they produce and what can they store and what can be packaged in that way, and not necessarily the ones that are the most beneficial for our gut. So I think I would always encourage patients to think about fermented foods to boost naturally. So, trying to get a good dose of fermented food in every day, ideally a breadth of different ones, but even if it's one that you like and you stick with and use it every day, fantastic. And that generally will give you a whole range of different live cultures, and hopefully in a way that's sustainable and also giving you the other benefits that food brings you. But if that's impossible or something you don't want to consider, I think a next good step would be a probiotic. But I wouldn't say it's the most superior option. That would be through diet.
Super, thank you, Anna. That's very clear. Now I'm going to come to Joe now, but Anna, if you wouldn't mind having a look, there's a few menopause related questions in the chat, and we're unbelievably into our last 9 minutes or so of the webinar. So we'll go through them probably pretty quickly in the end. But Joe, I'm just coming back to a great question that we got earlier on, similar to one that Anna was asked, I think, around estrogen levels. Are one's microbiome levels stable throughout the month, or do they fluctuate? Is there a better time to test your levels than another?
So we know that lots of things affect your vaginal microbiome, and we know, and one of those things actually is menstrual blood flow. So in my younger patients who've got problems, they get recurrent BV and thrush around about the time of their period. So those hormone levels can actually affect how your microbiome of your vagina is functioning. I mean, I guess in menopause, if you're not having periods and you're in a more steady state of hormones, depending if you're on sequential HRT, for example, or anything like that, then there should be less fluctuations because your hormone levels should be a little bit more sort of steady state. So I think for menopausal women, it probably doesn't make much difference compared to women who are still having regular periods.
Thank you. That's very clear, Joe. Thank you for asking that question. That was a great one. And Joe, we spoke quite a bit, Dr. Anna spoke quite a bit about the recommendations around lifestyle that one can make to manage gut microbiome health. Are there any, do you have any lifestyle advice? Or I know you touched on, but I think it'd be really helpful if you could recap around douching or cleansing, or any advice or recommendations that you would give people to maintaining a healthy vaginal microbiome.
Yeah, there seems to be a vogue, possibly more in the States, for vaginal douching, and I don't really get it. You know, your vagina is self-cleaning, just kind of leave it alone and stop putting stuff in it. And apart from, you know, obviously things like estrogen, but I think that interesting, all the things that apply to a healthy gut microbiome are good for your vagina too. So reducing processed foods, you know, avoiding high sugar content foods and all of those things. Stress is a really interesting factor. You know, we definitely see women who, you know, when they've got high levels of stress, that affects their cycle and their reproductive health. So because it's pro-inflammatory and can affect all sorts of parts of your body. I often tell women to avoid using perfume soaps and shower gels. Again, going back to using quite inert things like emollients to wash with, and you can use those on your vulval skin as a daily moisturizer. Cotton underwear just to avoid irritating your skin. So all those things just to avoid irritation of your vulva. And lubricants, again, important during sex if you're suffering from dryness, to again avoid that irritation. So pretty much very similar messages to what Anna has already discussed.
So good news, by maintaining a healthy diet and lifestyle, it benefits all parts of your body.
Absolutely.
Amazing. So yeah, fantastic. So, and we've discussed probiotics as well, and I know Eleanor has put some links into the chat as well. And Eleanor, I know you very kindly are offering a 25% discount as well. So I will include that information to go out in the newsletter with the link to the video. But if you have that available, and if it's up and live now, maybe you could include that in the chat as well, in case anybody would like to avail of it and try out some of the probiotics that we've been discussing. So just as we draw into the last few minutes, I can't believe the hour has gone so quickly. I mentioned that there was some menopause related questions in here. Anna, there's one here about diagnosis. Do you want to, have you seen that one? Do you want to pick that up?
Is it, how is menopause detected nowadays, and could we?
Yeah.
So, first of all, how is menopause detected nowadays? Well, that's a really good question. So we don't have any diagnostic tests for the menopause, other than if it's in someone under the age of 40, at which point we would be doing some hormone blood tests, because if they were postmenopausal under the age of 40, we call that premature ovarian insufficiency, and that's a diagnosis we'd really want to and need to make. But for women above the age of 40, we don't have any specific, like I say, diagnostic blood tests. So really we're looking at women having a change in their cycles, although even that isn't always necessarily true, but really having clinical symptoms that fit with being perimenopausal. So it's normally a clinical diagnosis based on listening to that woman's story, hearing how things have gone over what time frame, and talking that through. Sometimes I will do blood tests to rule out other things. So if someone comes to me with a vague symptom like fatigue, I might then run some blood tests to rule out other causes like anemia or thyroid dysfunction, but I'm not diagnosing the perimenopause, I'm simply ruling out other organic causes. And sometimes it might be a good time to do things like a cholesterol test or a diabetes screen, simply because it's a stage in that woman's life and it's a transition point to a higher risk time in their lives for those things. But so there's no official diagnostic test. It's an incredibly interesting idea of, could the gut microbiome be in some way used to detect changes? I obviously, there's at the moment no, but as we do get more advanced in terms of efficiently analyzing the gut microbiome, and I would imagine that it would be an element of looking at how the microbiome changed over time in any given one individual. And actually maybe with time there will be tests to add weight to, is someone perimenopausal, and maybe their gut microbiome shifting will lend weight to a diagnosis. At the moment it's not there, but it's certainly an interesting idea.
Yeah, thank you, Anna. And really, really clear. And I've included a link. We have a menopause questionnaire for free on our website that looks at all the range of factors that Anna mentioned. And you can use that to help you work out if and where you are in the menopause transition. And one of our last few questions, a really important question here, Anna and Judith. I'm really sorry to hear that your daughter's gone through chemo at the age of 15, and I really hope she's doing well. I'm sure that we all do. A really important question here that she's asking about her daughter. Would HRT be recommended for her if this happens?
Okay, so she's 15 and she's going through chemotherapy at the moment, is she? Okay, so it's quite a complex question in terms of exactly what regime she's on, what they might expect that to do to ovarian function, and whether it's, you know, how that plays out over time. But certainly that's something which...
No, sorry, she's just clarified, Anna, just to jump in. So she's 25 now and she's doing fine. So that's brilliant. Thank you for clarifying that. And I know this might be one of the ones where, as you said earlier, Joe, it'll really depend and you really need to speak to your doctor about it. But I think probably, Anna, the key thing is you flagged, and if you're going through menopause under the age of 40, it's really important to speak to your doctor.
Absolutely. Yeah, if you've got any queries, then definitely go and get some tests and talk it through.
Brilliant, thank you. So look, we're unfortunately we're out of time. I know there's a few questions in there and I'm really sorry we didn't get to them, but we'll be running another event with Restless next month. I'll announce the details and the date, but it'll be on menopause, mood and cognition with Dr. Claire. And I think some of the questions that you've asked in here will relate to that. But really thank you for all of your excellent questions, but a huge thank you to Dr. Anna and Dr. Joe. You've had long days at work and you've come on this evening to give of your time to help us all and to help our community just better understand our vaginal and our gut microbiome. And you've done it so simply and elegantly. And thank you for demystifying all of this for us and providing us with the tools to go out and find some more now. And for those of us with vaginal issues or with gut issues, I think we're leaving this evening's webinar with a much better understanding of how to manage them. And we really appreciate you giving the time for that. And thank you everyone for joining us this evening and for investing this time in your health, because to paraphrase from L'Oreal, because you're worth it. So thank you very much. Have a lovely evening and hopefully we'll see you again at another event soon. Thank you. Good night.
Thank you very much.
Bye-bye. Bye.